Assalamualaikum and hello. Welcome to our IHS522 video assignments, where we will briefly communicating the disease pattern and data for workplace management. Before we continue with this video, let me and my friend introduce ourselves. Hi, my name is Tashni Hussain.
Assalamualaikum and hi, my name is Rabita Shikin binti Nazri.
Hi, my name is Nur Shazin Elisha binti Muhammad Nizam.
Hi, Assalamualaikum. My name is Danish Aiman bin Bakri.
For these video assignments, we will be focusing on mining and quarrying sectors. Mining is a job where they extract valuable materials or other geological materials from deposits beneath the Earth's surface. Meanwhile, quarrying is the same job, but they extract a non-metallic materials such as stone, gravel, sands, and clay, where the materials are primarily used in constructions. In mining and quarrying, one disease that are commonly associated is black lung disease, or its medical term is pneumoconiosis, CWP. This is a respiratory condition that caused by long-term inhalation of coal dust. There are few early symptoms such as chronic cough, shortness of breath, chest tightness, or fatigue in some severe cases. There are two types of CWP, which are simple and complicated CWP.
This data, taken from the journal article Black Lung Disease Among Coal Miners in Asia, a systematic review, highlights the prevalence of black lung disease among coal miners in China, India, and Turkey. In China, out of over 650,000 miners studied, about 9% were diagnosed with the disease, making it the lowest prevalence among the three countries. In India and Turkey, although the total participants were much smaller, 360 and 457 respectively, the prevalence rates were significantly higher, with 37% in India and nearly 42% in Turkey. This extreme difference could be due to variations in working conditions, health policies, or how cases are detected and reported. The bar chart clearly shows Turkey with the highest rate, followed by India, while China remains comparatively lower. This emphasizes the urgent need for better safety measures and health monitoring for miners, especially in countries with higher prevalence rates. Moving on to the next slide, high-risk groups refer to specific populations that are more likely to develop black lung disease due to their characteristics or circumstances. Certain groups of miners are at higher risk of developing black lung disease. These include miners aged 35 to 44 years, those who have worked in coal mining for many years, and those who smoke or drink alcohol. Miners with existing breathing problems are also more likely to get the disease. Understanding these high-risk groups can help focus efforts on prevention and early care.
Risk factors are specific conditions, behaviors, or exposures that increase the likelihood of developing a disease. These factors can affect individuals in high-risk groups or the general population. Let's take a look at the risk factors for occupational lung disease. First, prolonged exposure to coal dust. Long-term exposure to coal dust significantly impacts respiratory health. Second, age-related risks. Older miners face higher risks due to age and cumulative exposure. Third, years of service. Longer service increases the likelihood of developing black lung disease. Fourth, behavioral factors. Smoking and alcohol consumptions weaken lung health and increase vulnerability. Fifth, pre-existing conditions. Workers with poor lung functions or respiratory illnesses are at higher risk. 6. Geological and production factors. Certain mine conditions or high production levels increase dust exposure. And lastly, inadequate health measures. Poor health practices and lack of monitoring worsen the risk. Preventive measures and improved workplace safety are crucial for protecting workers.
Okay, now we go to proposed strategies. Okay, the first one is enhanced dust control measure. Implementation of engineered control use dust suppression techniques such as water spray, dust collectors, and ventilation system. Regular monitoring of air quality. The second one is health surveillance and screening program. Regular checkups, spirometry tests to assess lung function and early detection of respiratory issue. Longitudinal health studies. Conduct a long-term study to track the health of coal miners over time. Okay, the third one is training and education. Okay, workers' education programs such as educate miners about risks of coal dust exposure, importance of PPE use, and safe work practice. Okay, next is behavior change initiative, promotes smoking cessation and responsible alcohol consumption. Okay, we move to the fourth one is improve occupational health services. Okay, strengthening occupational health services with establish a dedicated health unit within mining company, and then collaboration with health authorities. Okay, the fifth one is policy and regulatory frameworks. Okay, for enforcement of safety regulation, and then incentive for compliance. Okay, the final and is the research and development. Invest in research focuses on understanding the long-term effect of coal dust exposure.
That's all from us. Thank you for watching.